Today on Cancer Buzz, an award-winning program that aims to identify lung cancers at an early stage. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. All summer long, Cancer Buzz has featured the ACCC 2024 Innovator Award winners. The ACCC Innovator Awards are part of an annual program to recognize creative solutions in cancer care delivery and give other cancer programs an opportunity to learn from peers and replicate their successes. Winners present their programs in detail in the fall at ACCC's National Oncology Conference. Today's guest joins us to talk about her cancer center's program titled Creating a Community-Wide Safety Net for Centralized Tracking and Management of Incidental Lung Nodule Findings. Dr. Nina Thomas is the director of the Thoracic Malignancy Pillar of the Center for Lung and Breathing at the University of Colorado Cancer Center in Aurora, Colorado.
What we found was that the majority of patients who had incidental findings, meaning kind of unexpected findings on CT that were specifically lung nodules or growths, were not getting reliable follow-up. And while most of these lung nodules are not cancer, a small minority of them can represent early-stage lung cancer. And we're finding patients that were diagnosed with later stage cancer, stage 3 and stage 4, that's harder to treat, that on hindsight, when we looked back through their imaging, actually had a lung nodule that was never followed up.
Who on the care team was behind the new program?
Yeah, I think the real catalyst for this project was actually our nurse navigators in the lung nodule clinic in our cancer center. We already had a tracking system for our lung nodule patients that were referred to us, but she was the one that kept noticing these patients that had had lung nodules that were never followed up. And so she partnered with me and with the leadership of our cancer center and actually our CU Innovations team through UCHealth to find the best solution that would help us be sort of a safety net for these patients to make sure that they get followed up and that there was kind of a reliable, consistent method that we were following patients up.
What do you hope to talk to your colleagues about in person when you present this at NOC this fall?
Yeah, this is kind of a universal problem that we have throughout the country as far as early detection and following these patients up. And we all have very different systems that we work in, whether they're community or university, different sizes, different resources that we have. So I think the benefit of coming in person is that this can be more of a collaborative event where we can discuss ideas, share ideas and innovations, and figure out how to improve each other's systems, not just our own.
Why do you think an improvement program like this is important?
Yeah, I think one of the parts that's kind of hard for people to understand and why this project's important for lung cancer is that most early stage disease lung cancer patients present with no symptoms. And while there is lung cancer screening, which is extremely important, we often are not implementing it or including enough patients in lung cancer screening. And unfortunately, patients only get diagnosed when they have symptoms, and they only have symptoms when they have later stage disease.
Dr. Thomas will present this program at the ACCC 41st National Oncology Conference, which will be October 9th through the 11th in Minneapolis. There's a link to register in the show notes. If you haven't already, make sure to go back to catch up on the other episodes in this series of Innovator Award-winning programs. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.